Affordable health care has always been one of my priorities. Project Hope is on the front lines every day, helping people every day, being there every day. Your primary and preventative services, social and mental health services, and they're there each and every day. It's always innovating, always finding a way to do more, and provide it in a more efficient way. And that's why we're here today, and I'm glad to be back at the center. They're breaking ground for a new health center that will surround the old one as we build it, and then raise it, and ultimately leave a new, innovative, state-of-the-art facility. And we're one step closer to making it a reality. Now, with over 10,000 visits for almost 3,000 homeless patients, 93% who are below the poverty level, facility is a community health service haven, not just with the name of hope, but with a real mission of hope for those in need. So, as I said, every town, every city needs a great leader. Let me also thank your CEO and Executive Director, Patricia DeShields, and her staff for extraordinary work under difficult circumstances. This grant is a $4.7 million federal grant as part of the Affordable Care Act. And I like to always focus on that when I can, because we see all the detractors of the Affordable Care Act. As someone who is one of the co-authors of the act for the Finance Committee, I thought about all of those New Jerseyans who have no health care. I thought about all of those New Jerseyans who saw their costs rising in ways that were not sustainable for themselves, their families, or their businesses. I thought about federally qualified health centers as a high-quality portal for opportunity for people to get health care and to be able to do it just as those of us who might go to our primary care physician's office and get the same care, get the same quality, get the same attention, get the same dedication. And so we included under the Affordable Care Act, under my insistence, working with Senator Bernie Sanders, a whole provision of the law to fund federally qualified health centers and help many of them reconstruct themselves. And that's what's making this facility possible. And I'm pleased to have supported it in the Senate, and I'm pleased to have voted for it, and I'm pleased that we're here today to see it work. Now, Project Hope is the essence of community values and community spirit, reaching out to those who need a helping hand. And for those in need, this new facility will be their medical home. So I think we can safely say this groundbreaking is a welcome home ceremony for all who have come here at some point. All of you at Project Hope are the ones on the front line of healthcare. Community health centers like Project Hope are the backbone of our healthcare system, providing care to those who might not otherwise have access, keeping our families and neighbors healthy, helping them access affordable health insurance by guiding them either to Medicaid or to the new health insurance marketplace. And as I said, I'm pleased that the law recognized that contribution by providing $11 billion in total funding for 5 years to help our nation's health centers expand their operational capacity to serve nearly 20 million new patients nationwide. Now, here in New Jersey, that health reform, along with the American Recovery and Reinvestment Act, have provided more than $66 million in funding to make our state's health centers some of the best in the nation. We see tremendous growth in capacity, improvements in facilities, and ultimately significant improvements in the health of our communities. And the $4.7 million awarded to Project Hope for this facility is one of those improvements, helping to expand better capacity to serve the community here in Camden. You know, investing in community health centers like Project Hope is exactly the type of investment. It also will create jobs as it ultimately gets constructed, and expanding health access to health care and the improved health of our community that pays enormous dividends. You know, I sometimes wonder that we in life can go by someone who, but for the grace of God, would be one of us. and pay no attention to the individual and think that they simply do not exist, that somehow they blend into the landscape. When there is an illness in the community, it knows no walls, it knows no color, it knows no gender, it knows no race. And the illnesses that can flow from that are ours collectively. So we have a responsibility to our fellow man, and that is in essence what we are doing here most exquisitely at Project Hope. Finally, when I was part of drafting the legislation, I wanted to make sure that federally qualified health centers like Project Hope would ultimately be able to be paid in a way as if they were any other provider. So if they were a doctor, that they would be able to be paid as a doctor would pay. If they were at the great hospital here in Cooper, that they would be able to be paid as the hospital would be paid for the services that they render, and to honor the valuable role they have in our healthcare system, but not to be treated as second-class centers. So to ensure that communities and projects like this would be able to have the continuing revenue, because while we celebrate today the ability to have money to construct a new site, it's keeping it operating that is a real challenge. And so to ensure that communities and projects like these would be able to thrive in our communities, I had what is known as the Menendez Amendment included in the law to require private insurance in the exchange to fully reimburse federally qualified health centers for the services they provide. Now, as Kathy Grant knows, as an advocate of our effort here, the federal agency that ultimately has to administrate the law, CMS, doesn't always get it right, even though our language was pretty clear. And so we have worked assiduously to make sure that as the author, they understood exactly what I meant. Not some type of reimbursement, not less than, not 50%, but full reimbursement. And I think, Kathy, the new language that we finally got them to work out is going to get us to where we want to be. Now, FQHCs will not lose revenue for treating newly insured patients, gaining coverage through the exchange. And I want to thank all of you who have stood with us to try to make that happen. Let me close by saying, those of us in public life, the purpose that we choose this versus being in the private sector and making a lot more money is to be able to change the course of events for the better, to be able to improve the lives of those we are privileged to serve. Over the course of my career, which this year is now in its 40th year of public service, when I think about some of the most significant things I've been able to accomplish, it is not the legislation that I have passed dealing with foreign issues as the chairman of the Senate Foreign Relations Committee. And it's not about some other grants that we have bought. It really is to have helped build a series of federal health centers in the state that are all takers, meaning you come in, you have insurance, great. You don't have insurance, great. Everybody in the spectrum walks to a federally qualified health center and gets treated with the same dignity, the same grace, and the same opportunity. And in that work, for all of those who work here at Project Hope, is an opportunity to turn around a life. Those who come in ill and can leave healthy. Those who may need a longer term assistance and can achieve it. Those who ultimately, in which we can really save a life. There is no greater compensation than being able to be in that role, to play that opportunity to affect the life in such a positive way. That's what our federally qualified health centers do, and that's why Project Hope is full of hope and full of opportunity, and that's why I'm so glad to be here today. Thank you very much.